Good day, everyone. I am Christine Cadenas, and today we're talking about protein metabolism. So, I won't explain any further because Shireen explained it to her video. So, first, what is protein? Protein is a large molecules comprised of amino acids. Amino acids linked together by peptide bonds to form polypeptide chain. Proteins are not stored in the human body. They are constantly broken down into their constituent amino acids and then reused protein synthesis. The overall turnover in adult man is equivalent to replacement of 1 to 2% of the body protein each day. The amount of specific protein in the body is kept constant. Nitrogen balance. The amino acids are the main source of nitrogen. Nitrogen balance or NB is a comparison between nitrogen intake or dietary proteins and nitrogen loss in digested proteins in feces, waste excretion as urea and ammonia in the urine. For normal adult, ingested nitrogen is equal to excreted nitrogen. Positive NB or nitrogen balance, ingested nitrogen and excreted nitrogen. Ingested nitrogen is for child growth and excreted nitrogen for pregnancy. Negative balance or negative nitrogen balance, ingested nitrogen and excreted nitrogen may follow surgery, advanced cancer, marasmus. Next is tissue proteins. Protein turnover, continuous degradation, and synthesis of proteins, replacement of 1 to 2% of the total body protein each day. Amino acid pool, accumulation of free AA in the liver and the blood. 75% of the liberated AA from tissue proteins are utilized. Degradation or catabolism of AA. Excess of AA are not stored, but rapidly degraded for the synthesis of glucose, glycolysis, and lipids. Degradation of excess AA causes an excess of nitrogen, and waste as the nitrogen excess is transformed into urea or 80% and ammonium in order to be thrown away in the urine. Absorption in the human body, the small intestine, and the stomach. Once a protein molecules are swallowed and enter in the stomach, chief cells in the stomach release the enzyme pepsinogen. Pepsinogen is an active enzyme because if we're an active enzymes, it will destroy protein located in the stomach. Hydrochloric acid releases from the stomach causes low pH level and HCl actually activate pepsinogen HCl causing the stomach open up for protein. Next is protein digestion in the small intestine. Chemical digestion or pancreatic juice produced in the pancreas, pancreatic enzyme or the trypsin and chymotrypsin, polypeptides to oligopeptides. So as we can see here, there are an action of pancreatic enzymes. Trypsin or endopeptidase cleaves the peptide bond at the carboxyl side of the lysine and arginine. Chymotrypsin is endopeptides cleaves the peptide bond at the carboxyl side of tryptophan, tyrosine, and phenylalanine. Protein digestion is completed in the small intestine by brush border enzyme carboxylic peptidase, aminopeptidase, and dipeptidase. Endopeptidase is trypsin cleaves at the COOH side of the lysine arginine. Chymotrypsin cleaves at the COO side of the tryptophan, tyrosine, and phenylalanine. Tri or dipeptidase cleaves between AA of tri or dipeptidase. Exopeptidase or carboxypeptidase removes AA from the COH end, and aminopeptidase remove AA from the NH2 end. So here we have an illustration. So in summary, Here is the summary. Stomach, pepsin, dietary protein to gastric phase, then polypeptides. Pancreas, trypsin, chymotrypsin, or intestinal luminal phase, then oligopeptides. It form oligopeptides. That would be all. Thank you.